Hello students, today we will study bioavailability. Bioavailability, see the therapeutic effectiveness of a drug is depend upon the ability of a dosage form to deliver the medicament to the site of action at a rate and amount sufficient to the pharmacological effect. So bioavailability is the rate and extent of absorption of unchanged drug from its dosage form. It's an absolute absolute term, you can say a term, that the rate at which the drug is absorbed and is important consideration when rapid onset of action is required. And you know very well that a rapid action of onset is generally required when in the acute conditions like asthma attack, pain, etc. And a slower absorption rate is used when we aim to prolong the duration of a drug or to avoid adverse effect. So if we say the size of a drug or for a treatment of acute or chronic condition, the bioavailability will depend upon the pharmaceutical factors. Well, you know, the pharmaceutical factors are always linked with the physical chemical property of the drug, patient related factors, and route of administration. So, seeing this, the bioavailability will be ranked. It's more in the parenteral than oral, than rectal, and then tropical. So comparing with the IV route has the maximum amount of drug. Matlab, all the drug is directly enter in the systemic circulation. So parenteral route offers 100% bioavailability. However, for the stability and convenience for the most of the drugs are administered orally because parenteral required a technique. So the dose available to the patient is known as the bioavailable dose and is uh, often less than the administered dose because there are several factors that could influence the absorption of a dose. So the drug that reaches to the systemic circulation is known as systemic bioavailability. So, if we see the bioavailable fraction, that is F, it refers to the fraction of administered dose that reaches to the systemic circulation. So, F is the bioavailable fraction which is equal to bioavailable dose upon administered dose. So, what are the various objectives of studying this bioavailability? See, the first is that in primary stage, pre-formulation study, when we used to develop a new drug into a dosage form to determine the influence of excipients, patient-related factors, and possible interaction with other drug, to develop new formulation of an existing drugs, control quality, comparison